Spondylolisthesis is a condition in spine where one vertebra over the other slips forward. For example, here this is the lumbar spine. You see here there are multiple bones and there are discs in between the vertebrae. So here what happens, for example, this is L4, lumbar 4 vertebra, lumbar 5 vertebra. When this bone over this bone slips forward, so this we call it as spondylolisthesis. There are various grades of this spondylolisthesis starting from grade 1 to grade 5 depending upon the severity of the bone, how much percentage of this bone is slipping over the other. So this spondylolisthesis is very common and affects patients very badly in day-to-day life. How can it affect? It can cause back pain, which is very common, which can cause leg pain, giving the symptoms of sciatica, or it can cause paresthesias or numbness in the both lower limbs. Especially these patients has difficulty in walking, sitting and sleeping and turning in the bed. Then what are the causes of this spondylolisthesis? There are various causes, common being congenital, where there is defective bone formation. As a result of this starts slipping forwards as age progresses. Second is the trauma. When patient has trauma, this can get fractured. The bone connecting between the upper vertebrae and lower vertebrae can crack or break and it leads to spondylolisthesis. And the third common cause is the degenerative aging spine, where the joints in the back of the spine and the disc in between the two vertebrae gets degenerated and this spine starts getting mobile and it starts slipping forward, leading to spondylolisthesis and causing symptoms in elderly patients. Then how do you diagnose this common condition of spine? How do you diagnose it? So there are various ways of diagnosing it. Best way is to get a simple X-ray spine where we can see what is the bony defect or bony problem in the spine. If we want more detail, we can get a MRI lumbar spine or a CT spine which will give more information about the slip of the vertebrae, and it can give more information about the nerves which are getting compressed because of these slipping, or what is the state of joints in the back. So this information can be gained from X-ray, MRI and CT spine. Then what to do once a patient has symptoms and patient has problem on MRI and CT scan and X-ray, what does patient do? Once he visits a doctor, a spine surgeon, neurosurgeon or any other physician, everyone is advised of medical management. So you give some medicine for pain, some rest. Once the pain comes down, we start them on aggressive back strengthening exercises, physiotherapy and some other pain management procedures like injections for the nerves, injection for the joints. This is a medical management where most of the patients get better. So spondylolisthesis, not all patients require surgery. Most of them can get better with a good lifestyle management and exercises and physiotherapy. If this patient is not getting better, so patient has pain which is relentless and his day-to-day life is getting affected, quality of life is getting affected, and even the medical management is not working much, definitely there is a good news, because we do have a management where we can treat this condition with surgery. So all these years fear of surgery was because it has to be done with open surgery. There is a big incisions and we have to fix the spine with multiple screws and rods on the either side. For this surgery, we need lot of muscle damage, muscle trauma is there, bony damage is there, the chance of nerve injury is more, and the biggest is the blood loss. There will be loss of blood, and post-operatively patient will have lot of pain because of the big incision, and maybe we have to keep the patient in the hospital for a long time. So this was the one fear in patients where getting spine surgery, they might have a lot of problems post-operatively. So the fear and the myth that they might become paralyzed was the main reason why these patients suffer pain but not get the proper treatment on time. Now, as I said, the good news is that this can be managed with the least invasive approach, what we call it as endoscopic spine surgery. When a patient requires surgery, definitely we can do these surgeries endoscopically. The same principle where we need to fix them, we need to reduce the slip, we need to jack up the height of the disc, and we need to decompress the nerves. Everything is done endoscopically, and we put the screws with the least invasive approach so that patient post-operatively is able to walk immediately after surgery with less pain than open surgery, and patient can be sent home the next day itself. That's a big advantage. Such a big surgery done endoscopically and patient goes home next day walking. That's the biggest gift to the patient, where all these years he was having so much fear, but now we have done this surgery with endoscopy. So spondylolisthesis today can be operated endoscopically, and we can do very good spinal fixation, what we call as endofusion, endoscopically, and send home patient with the least pain, least scar, and almost no blood loss with very less complication. Then there are issues whenever you do either any surgery to the spine. There are issues long term, what patient need to take care. Commonly they ask, if I get this operation done, is it end of my agony? That is not correct, because the surgery was done to align the spine and correct the problems, but to maintain that, patient need to be on constant exercises, physiotherapy or the lifestyle management. This is a continuous process. So not to have the problems on the spine where we have operated, or spine above or below, we need to do regular exercises and take care of his spine to have a pain-free future.